The issue of the variants, and there are concerns over the spread of the three lineages of the variant of COVID, which was first found in India. That's B1617, which initially, if you remember, the media called the double mutant strain, but a lot of experts had an issue with that. Now, the World Health Organization did say during its weekly update that B1617 variant with its subvariants have been found in at least 44 countries. The variant's rapid rise has also triggered alarm in other countries, including the UK, which has found it to be responsible for the second highest number of infections. Well, to talk more about COVID and the fresh developments, we're joined by Dr. Faheem Younus, Chief of Infectious Diseases, University of Maryland, Upper Chesapeake Health. Thank you so much for joining us, Doctor. Now, the WHO has said that B1617 is a variant of global concern, and also how it has been found in 44 countries. What could this variant mean for the current pandemic?
Of course, all of these variants are a concern for India as well as for adjoining countries in the world. But I think we got to be careful drawing too many conclusions because the genomic sequencing is not to that level. Last I checked, it was less than 1%. And India is a large country. Many countries have struggled with that. So far, it seems it's highly transmissible. Is it more lethal or not? We don't know. How many vaccines actually affect it, and is there any vaccine escape, if at all? We don't know those things. So I do think people should be balanced, not create any panic, and reassured that with good quality masks and with adequate vaccinations, we can most likely beat this variant.
Now, Doctor, there are also cases of concerns in India with many cases of this black fungus or mucormycosis being reported in recovered COVID patients. We wanted to hear from you. Have you had such cases in the United States or heard of it in other countries?
Yeah, I don't think that we had that many cases here in the United States, or we had any outbreaks, or we had any increased number of black fungus or mucormycosis, as we call it. Now, there could be various reasons for it to be spreading in India. I think the commonest could be increased level of diabetes, uncontrolled diabetes, and then inappropriate or extra use of steroids or Decadron. If we are using it in more patients, or if we are using it in higher amount or for longer durations, all of that can make you prone to these funguses. Another X factor, which I don't think has been studied well, but is a good hypothesis, is how clean the environment is, because this is a spore that lives in the soil, in the environment. So is it linked to some of the common traditional practices where people may be more exposed to this spore in the soil, sometimes even in the oxygen supply? All of those are interesting questions with no sharp answers right now. The last point I do want to make, though, it's still a very small number when you look at the total number of COVID patients, and we should never use the word spread for it because it's not contagious. It does not go from person to person. So I just want people to remember that it's a complication of immunosuppression. It is not a direct complication of COVID, and it does not go from a person to person.
Right, an important point there. Now, speaking of drug use, as you're talking, there's a particular medicine, ivermectin, which currently in one of our states in Goa is being given to all adults as a preventive. Now, at the same time, we do know the World Health Organization has warned against it. However, there's also a study that claims it could possibly reduce chances of contracting COVID. So a lot of confusing messaging.
Sure, I think this is not confusion. This is intellectual arrogance when we insist on our own opinion in comparison to where the evidence and where the science lies. If I say that the speed of gravity is 6.8 meters per second instead of 9.8 meters per second, that's not confusion. That is my arrogance or my stupidity. So I really think that at this stage there is overwhelming evidence that ivermectin does not have any clear role. It's a good drug to study, but as of today, we're not at a stage to wholesale recommend it for any population. No Western country has done it. No large scientific body, whether it's at Infectious Disease Society of America or CDC or WHO, endorses it. So there shouldn't be any confusion when there is such significant or overwhelming evidence. about the use of something or not the use. So I don't think ivermectin should be recommended.
All right. Good to get your opinion on that. Finally, an issue that we were just discussing on the show earlier, having both doses of vaccine and then testing COVID positive. Many people are worried regarding this. What is your message for such people?
I will ask them, what is their alternate? If they don't get the vaccine, do they have a better choice? And the answer is they don't. They can make up whatever they like, but scientifically, they don't have a better choice. No vaccine is going to be 100% curative. No treatment we use produces 100% results. So even if it's 70%, 80%, 90%, that's the best alternative you have. So the question you should ask, is it safe? What is my risk of taking the vaccine versus not taking the vaccine? And guarantee you that COVID is a far greater risk. So if you're not taking the vaccine, don't think you're safe. You are exchanging that with the risk of COVID and its complications. So unless you have a better scientific solution, I don't know why someone will decline a vaccine which has been effective, which is going to be the final key to end this pandemic.
All right. Well, thank you so much, Dr. Faheem Younus. Always great to have you on the show.